retinaculum, and the last part which remains for this video or this topic would be the clinical anatomy. Always remember a very crux of the point that whenever you write the short notes, the question does not ask you about the clinicals, but you have to write it. The major point, the important thing, why you have to write these clinicals in the short notes wherever it is not asked also, but you have to write. The reason is you can earn more marks. An extra mark is given when you write the clinicals. The person who does not write the clinicals can also get 3 or 4 marks out of 5. But the one who can write clinicals in that with a very different, distinct subheading as a clinical anatomy in any question related to any topic, that definitely earns you extra marks. So this is a very important advice I want to give you to all. Whenever you read any topic, not only flexor retinaculum, any topic in anatomy, you have to always at the same point when you are reading a topic, quickly after finishing the topic, you have to pick up the clinical anatomy of that topic and you have to learn that. You have to understand and learn that and clinical anatomy, and just remember to write it whenever you write in the exam related to any topic. So for that purpose, we are going to learn the clinical anatomy related to our topic of this video, which is flexor retinaculum. So there is a very simple clinical anatomy, just one clinical anatomy over here is the carpal tunnel syndrome. We have seen that the bridging of that retinaculum is forming a tunnel. We have named that tunnel as carpal tunnel because of the involvement of carpal bones. It is present in the area where is a carpus or wrist joint is present. We have simply named the syndrome also as carpal tunnel syndrome. So the name itself is a self-explanatory, that is, it is a syndrome related to our carpal tunnel, related to the structures passing through the carpal tunnel. So what is the cause for this disease? The cause is compression of median nerve. Where was the median nerve? The median nerve was in relation to the deeper side of flexor retinaculum. It was passing deep to flexor retinaculum. So whenever this median nerve is compressed, the syndrome, the disease which happens, it is named as a carpal tunnel syndrome. How can this median nerve be compressed? It may be due to bursitis. What is bursitis? Bursitis is nothing but inflammation of bursa. Whenever this word comes, itis is always the inflammation, whatever it is. Itis, whenever it is added as a suffix at the last of the word, it is means inflammation. So bursitis, bursa, itis is inflammation. So inflammation of bursa. What is bursa? I have just mentioned in the deeper relations when we are learning the structures passing deep to the flexor retinaculum. I have mentioned what is bursa. Bursa is fluid filled sac or cavity to avoid the friction at joints during movements. And whenever, because we have seen the two bursa are passing deep, on the medial side there was a ulnar bursa, on the lateral side there was a radial bursa. To avoid the frictions, if somehow this bursa is inflamed, that inflammation may cause the median nerve, which is also passing with the same bursas deep to the structure of retinaculum, that median nerve because of bursitis may get compressed. There may be different reasons also. This is one reason which I have mentioned. There can be different reasons for the compression of median nerve leading to the carpal tunnel syndrome. Then after seeing the cause, we have to see what are the symptoms of this carpal tunnel syndrome. The carpal tunnel syndrome के symptoms include motor symptoms, sensory, vasomotor and trophic symptoms in the hand. Other thing which is visible in this would be the thenar eminence muscles की wasting of the muscles of thenar eminence. So muscles of the thenar eminence are wasted, which gives rise to the ape-like hand. What are the muscles of thenar eminence? Let me just enumerate for you guys that muscles of thenar eminence include abductor pollicis brevis, flexor pollicis brevis and opponens pollicis. These are the set of thenar eminence ki muscles which may get wasted, giving a ape-like hand appearance, which is one of the symptoms of carpal tunnel syndrome. And the other symptom can be hypoaesthesia. What this word means? Hypoaesthesia means partial or a complete loss of sensation, because this median nerve is supplying to the 3.5 digits of the lateral side, which you will learn when you will be learning about the median nerve ka course and distribution and supply. Just remember for now that median nerve is going to supply the lateral 3.5 digits. What are the lateral 3.5 digits? Thumb, index finger, middle finger and the half part of ring finger which is adjacent to the middle finger. Means that half of the ring finger which is on the side of middle finger, This completely comprises of our lateral 3.5 digits supplied by the median nerve. And whenever if this median nerve which is supplying these structures is compressed, definitely the sensations on this part would be lost. So the partial or complete loss of sensation, which for this one word is hypoaesthesia, to the light touch on palmar aspect of lateral 3.5 digits. Loss of sensation on this part. So what would be the test performed for the carpal tunnel syndrome to be detected? The simply 2 टेस्ट के नाम हमको याद रखने हैं जो हम परफॉर्म करने के लिए बोलते हैं पेशेंट्स को टू सी इफ ही और शी हैज़ द कार्पल टनल सिंड्रोम. One would be the Froment's sign or a book holding test, and second would be the paper holding test. These 2 names are self-explanatory again. Book holding test means the patient would be unable to hold that book, any book you give to the patient, between the thumb and the fingers. Similarly, the paper holding test would be the patient is unable to hold the paper between thumb and fingers. So you have to just remember the names, and names are self-explanatory. Book holding test and paper holding test cannot be performed by the patient who is having a carpal tunnel syndrome. The other name for book holding test is Froment's sign. If you remember, that is again a very good point. If you don't, you can just write book holding test and paper holding test. This is the image of how a hand looks of a patient who has a carpal tunnel syndrome. See this thenar eminence, the wasted of muscle. This hand is an ape-like hand. We have seen that it gives an ape-like hand because of the wasting of thenar eminence ke muscles. So this picture is of this patient having a carpal tunnel syndrome. So we have completed everything. We have covered everything related to these topics, the definition, the Latin meaning of this, the attachments of flexor retinaculum, and at the last, the relations of flexor retinaculum. I have drawn the diagrams also over here, from which we could easily understand the relations and even the attachments. And this is all for this topic. We have completed everything related to the topic without missing anything. So that's all for today's video. Meet you all again in the next video with a new topic. Till then, stay safe, stay happy. Thank you.